Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what is most urgent? Healthcare organizations across this nation are vying for a piece of this $50 billion Rural Health Transformation Fund included in the One Big Beautiful Bill. States can start turning in their applications for funding later this month, but as we've reported on the podcast before, this funding will cover less than 1% of the cuts being made to Medicaid, not to mention the additional effects of Medicare cuts required to offset the deficit that the bill creates. The Centers for Medicare and Medicaid Services will review applications from the states by the end of 2025, but that doesn't even mean that states will receive funding immediately. In fact, the One Big Beautiful Bill states that the funds can be distributed between fiscal years 2026 and 2030, leaving plenty of time for the administrative barriers to slow down the process. If the funds actually help rural health, despite its disproportionate to the losses the industry will experience, it may be too late for many hospitals and health organizations suffering the effects of Medicaid and Medicare cuts that are projected to start as early as next year. I'd like to remind our listeners that 40% of all hospitals operate with negative margins, and that percentage is closer to 50% for rural hospitals across this country. So every day's reimbursement, every day, counts toward keeping their doors open to the community. Among the organizations hoping to claim a piece of the funding are home healthcare operators, critical access hospitals, rural emergency hospitals, rural health clinics, federally qualified health centers, community health centers, community mental health, opioid treatment programs, and more, as long as they are located or treated as being located in a rural area. The second category of being treated as rural means that urban hospitals will be counted as eligible for the Rural Health Transformation Fund. Over the past decade, an increasing number of urban hospitals have reclassified as rural for improved Medicare payments. As early as last month, more than 400 urban hospitals have made the change. While many urban hospitals serve high populations of rural communities, their part in the Rural Health Transformation Fund will mean less funding for genuinely rural hospitals. The fact that the bill excludes language that explicitly includes the specific category of urban hospitals tells us that the authors of the bill are well aware of their urban nature and benefits they receive as being treated as rural within the Medicare payment system, while not necessarily serving any more rural patients than another urban hospital. There's a lot more to the story than we can even include in this short update, so check out the show notes for a link to the study by Johns Hopkins and Brown Universities that was published last month on the urban hospitals undergoing this reclassification. On to the damage report. A recent study by KFF reveals some concerning trends in Medicare Advantage data, especially for rural hospitals. In 2015, 13% of total hospital inpatient days were attributed to Medicare Advantage enrollees. Now that number is 50%, meaning half of inpatient days are covered by Medicare Advantage. We've reported on this podcast before that rural hospitals are struggling more than ever to afford Medicare Advantage contracts because the plan pays lower reimbursement rates than even traditional Medicare. Our rural communities' increasing dependence on Medicare Advantage is putting our hospitals in an alarming position as inpatient days under the plan rise and its share increases as traditional Medicare decrease. Between 2015 and 2023, the share of inpatient days for Medicare Advantage enrollees among rural hospitals more than doubled, and in some cases tripled for counties that are considered the most rural in the nation. We've seen the damage this shift is already having on our rural hospitals, and with the cuts to Medicare and Medicaid ahead, many hospital leaders are struggling to see a sustainable pathway forward. In other news, 20 hospitals have closed in 2025, outpacing the total 25 closures in 2024 and setting a disturbing precedent for the rest of this year. And now for today's success story. Despite the growing concern we and many other hospitals have experienced regarding the direction of HHS, we have some good news to report. At the end of last month, HHS launched a dashboard to keep careful track of organ transplants that skip patients on waiting list. This has been an issue for years, but over the past year, it's gained traction. In 2024, 19% of organ transplants skipped patients in line, a new shocking record for organ procurement, and 2025 hasn't seen much improvement so far. HHS intends to expand its jurisdiction to include organ transplants and enforce accountability in the system that can be easily accessed by providers, patients, their families, and yes, the general public. If you want to see this dashboard in action, check out the link in the show notes. Thank you to our sources for this episode: Modern Healthcare, the National Rural Health Association, Johns Hopkins Health Affairs, KFF Health News, Becker's Hospital Review, and the Department of Health and Human Services.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.